So, what's tougher, handling paparazzi or the toddler questions? So, welcome to Live Long, Live Well, where health meets Tollywood glam. I'm your host, Dr. Chaitanya, and today I'm joined by the gorgeous Anisha Ambrose, actor, model, finance professional, and now a supermom. We're going to talk about balancing stardom, health, and motherhood. And yes, we'll dig a little bit into some juicy gossip too. How are you doing today, Anisha?
I'm doing great, Chair.
And how's life treating you as a mom
Life
and
has
an
been
actor?
treating me very well, actually. And I'm able to balance both sides, so I feel a little efficient.
Has anything changed?
Changed, a lot has changed. I've changed as a person. And honestly, in this phase of my life, I'm enjoying everything, like everything about it. Being a mom and being a lot more responsible. I think I'm really, really having a great time.
So, on a regular context, right? Anisha and me talk at least once or twice a week.
Yeah, we do.
Anisha and me are
Yeah,
good
this
friends.
is like a little too formal. But otherwise,
Yeah,
we'll be talking very differently.
This is probably the most formal
conversation
we
we've
are
had.
going to
Yes,
have.
but I'm very proud of you that you've taken this this opportunity to start this podcast, and I think it's a great idea because you're not just helping your patients inside your office or your cabin, but you're trying to reach out to many other people all around. So I think that's fantastic, and I'm very proud of you.
Thank you. So, my entire idea of doing these podcasts with movie people, with other doctors, with cricketers, the idea is first and foremost, there are a lot of things that go on in your life which
Yeah.
don't go on in my life.
That's right.
There are things that go on in my life which you will not even understand.
Absolutely.
So there are what we think are necessities in life which many people find it absurd. Many of you who tackle like your work as an actor, actress, movie directors, movie producers, the stress they go through is something I cannot imagine. So the only way we want other regular doctors, other actors, any motorsport enthusiast to know is when it comes straight from the horse's mouth, right?
True.
So here you're here as an actor, not as my friend today, which you will always be for the rest of your life. But our idea is to tell our audience what you go through.
Yeah.
And what are the things, see, because you were a business professional, you did MBA,
Yeah.
then you did acting,
Yes.
then you got married to
Yeah.
Guna. Guna is also a friend of mine. Huh?
Yeah.
Then she has two lovely boys together.
Yes.
I think they're 5.5 and I think 3.
3. Yeah.
Right? And they're notorious. So because whenever I go there, they want to be with us. And as much as we'd love for them to be with us over dinner and drinks, we would not want them to see an adult like me who's at 43 having a drink. We don't want them to see, right? So I know what goes on. So we wanted people's perspective. Unless people like you come out on a podcast like this and tell the audience what it is like, there is no way for people to understand. And of course, then we'll get a little gossip, juicy gossip from Anisha, hopefully, which will keep you entertained. So that was our idea. And when it comes from other doctors, see, as a physician, I'm a critical care person. I have enough degrees to my name. But I will not know how a life of a cardiologist is.
That's true.
So when, as a doctor, I do not understand another specialist's life completely, I cannot expect the common man to understand it. I can say, yeah, we work 10 hours a day. But that 10 hours a day is
What
very
are you
different.
exactly doing those 10 hours?
10 hours of a day in a critical care person's life is very different from a surgeon's life. It's very different from a gynecologist's life. Like, oh, you're a doctor is but it's not as easy as it sounds. It's not the same. Everybody's life is not similar. For example, an actor's life is probably very different from a female actor's life because she's the mother of children, like Anisha. She has 2 children. She's the daughter to her father and mother. She's responsible for them also. She has a husband who takes care of her, and she's actually, in fact, as she also takes care of her husband. And then because Anisha's father and mother are my patients.
Yeah.
But I know Anisha from before.
Even my mother-in-law is your patient.
Your mother-in-law, your father-in-law,
My aunt,
you,
me.
you.
So you're a family
So
doctor.
we all are, you guys, all of them come to me. And, so we wanted her perspective of how it is, her issues with the different things in life, how stress can be managed, and all multiple questions that she's asked to me. I wanted this conversation to happen so that people also understand individual lives and what it is to be an actress and what are the stresses that you go through. So maybe we can talk it out and help each other. That was the entire idea of this podcast.
Yeah.
So tell us a little bit about how your day looks like from waking up till you sleep, between your family, your work, your children, and maybe dropping them to school in the morning to picking them up.
My day is very structured, and it starts off at 7 a.m. I'm not an early riser at all. Get the kids ready to school, send them off to school, and then after that I get in some reading time, then hopefully a good workout. Right now I'm also helping out with my family run business with our schools, so I have a lot of calls to take in the morning, helping them out over there. I keep traveling now and then from Vizag and back just to see to things. And yeah, in the evening, once the kids come back, by the time the kids have dinner and wind up, we're also equally tired like them. There is no scope for doing anything else. Sometimes Guna and I, we want to watch a movie together once we put the kids to sleep, but that lasts about half an hour. As soon as we are done eating, we're off to bed.
So it's like a movie takes 5 days today to watch.
Yeah, exactly. A movie takes 5 days. A series takes forever to watch. I guess many parents will relate with this, but that's usually how my day goes.
So it's a full-fledged job.
Yeah, it's a full-fledged job. You don't have time for a lot of other things that you used to have time for. But I have no complaints because it's so fulfilling at the end of the day. And I never thought that, having a family, having 2 kids would be such a fulfilling experience. But it is, and I'm so grateful for it.
So see, you went from doing an MBA, then you did modeling, then you went to movies, then you got married.
Yeah.
And now you have children. And that too, 2 boys, and those 2 boys are not the regular boys. They are absolutely notorious, lovely kids.
Yeah.
So how is each of these phases, as in from doing your college, your MBA, to your modeling, your movies, to getting married to Guna, that phase, and then having the first kid and then the second?
See, Jay, every season of your life is transformative. And for me, it has been like that. When I was working, it was different. When I joined acting, it was different. Marriage again was a whole other ball game altogether. But I feel like every phase has only made me and transformed me into a better human being. And right now, I'm enjoying my life to the fullest. And I'm so grateful for whatever lessons I learned in the past or whatever life has brought my way. It has led me to this point in my life, and I'm so happy.
You're happy. So when you were doing your MBA, I'm sure you were very happy. You must have been a good student because I know you.
So you want to know? Yeah.
So you know the question that I want to ask. So how did you get into movies from this?
It was really, really random, okay. So when after I did my MBA, I actually started working with Dell. And I realized that 9 to 5 is not my cup of tea. I could see my future and I decided that is not me. So I was looking at something else to do, and very randomly on Facebook, I got an audition call on Facebook by a message. And my dad was the one who supported me the most. And if he had not supported me with this new idea of trying to get into movies, I would have never become an actor.
You would probably be in Amazon or
I
Microsoft.
would be doing something totally different. But it was his enthusiasm, and he was like, wow, this is something great, something new. Go ahead, try it. And that's exactly how I ended up doing my first film. And then I started enjoying it. So for me, that was like a hint that I should keep going. in this profession.
As a doctor, I'm a little curious.
Yes.
So, did motherhood make you think differently about your health, fitness, and your well-being? The reason I'm asking you this is because I know you go to the gym every day. In our group, I keep seeing you go working out and all, and she works out hard. Huh? So that's the reason why I have this question. So everybody should get an insight into Anisha's life.
Jay, I started working out at the age of 25. So I always had a mindset where I wanted to always be fit. For me, fitness journey was very different. I was very skinny. So I had to start working out to put on weight. So my fitness journey is not the usual fitness journey of everybody's. But once I got onto it, I was hooked on. So when I got pregnant, I knew that through my pregnancy, I wanted to continue my fitness journey. So I worked out while I was pregnant. Till I was 8 months pregnant, I was working out. And I decided that I wanted to have normal deliveries only so that I can bounce back and get back to my fitness routine. So that has always been top priority for me. And because I did start working out earlier in life, it wasn't difficult or it was not something that I shouldn't try out while I was pregnant. So what I was told is that anything you're used to doing before your pregnancy, you can continue doing while you're pregnant, but you shouldn't start anything new. So that's what helped me a lot. So I think worked out well.
So see, right from your MBA, you went into a movie career. Off the movie career, got married. Then straight motherhood with 2 children. And I think the older one is almost 6 years old.
It's 5.
5 years old. Because my fellow and him are about the same age, 5 and a half. With this movie, Visham, this is after quite a break, I think about 5 years.
Yeah.
How did you prepare for that physically, mentally? Physically, you answered point blank because right from a young age, you were in the gym, you wanted to have a normal delivery. So you've been working out till your 8th month of both your pregnancies. Then even now you post pictures on your private Insta where it is private. So far, for we know that you work out. So physically done. Mentally, how did it prepare you? Because there's a lot going on at home.
See, of course there is, but to be very honest, when I went to meet Srinu Garu and he narrated the script to me, instantly I knew that I wanted to do the film because first of all, it was a character of a young mother who is battling cancer and has to go through her pregnancy. She doesn't want any side effects to affect her daughter. And so the struggle, basically, that's what they film. And for me, being a new mom at that time, I could understand the pain that the character is going through. So for me to be portraying such a strong character, that's something I wanted to do. So I flew into it really easily. In fact, when I went on to set, Che, I felt so liberated to be on set for the first time. That in itself was like therapy for me. I hadn't done it in a while, and initially I was a little nervous how it would turn out to be. But the whole atmosphere over there just lifted me, and I felt like home. So it was a great experience, and it came out also so well. The song came out so well.
See, because when all these things are going on, like planning for the movie, you must be having interviews, video calls, Zoom calls. Did your kid ever crash any of them? Either of the one. I'm pretty certain the older one is very naughty.
See, usually whenever I'm at an interview or something, I try my best not to be at home and do it somewhere like how I'm doing this interview over here. That way I'm a little smart because I know I can't expect much from my kids, especially if I have them in the same house. They're going to be screaming on the top of their voices, and I know that it will be unfair on my part to ask them to shut up.
It's their home.
It's their home. So I try not to be at home and be somewhere else so that I get my work done.
So kid never crashed a Zoom call because she
I'm
never stayed at home.
I'm wise that way. I know my kids.
So did your perspective change on the kind of roles you want to do? Like from E Nagaraniki Emaindi to Vishwam. There's a complete contrast from a college going girl to a mother battling cancer and her not wanting the side effects of the medication to affect her
The
child.
baby, yeah.
Has your perspective on the roles you want to choose changed?
Of course it has. See,
Not
I've
that you look
always-
any older. You can still pass for a young college girl. But
honestly, I always wanted to be a part of scripts that are very interesting. But now at this stage in my life, I want to do only strong characters. Something, that is relatable, also with a meaning. Because at this phase in my life, when I have 2 kids, I'm sure at a point they're going to watch my movies. And my world revolves around them right now. And so it is very important to me that in everything that I do, that I am a good example to them. So that's how I look at it.
so, how is it working with Srinu Vaitla garu? See, he's known for his action comedy hits, right? How is it working for him?
See, I worked under Srinu Garu and I also worked under Vrinda Master because she was directing the song. It was a song sequence. It was a high energy environment through the shoot. And I got to learn so much. And also, it is great when, as an actor, you're allowed to emote your character the way you perceive. Sometimes you always have the director telling you what to do or somebody telling you emote this way or that way. But here it was an emotion that flew through me, and it was very natural. And working with Srinu Garu is great. He knew exactly what he wanted. When he narrated the script to me itself, like in his narration itself, I felt like, no, I can't skip this. I have to do this. So you can understand, how the whole atmosphere of the set would have been also.
See, like you said, right from that Facebook audition letter coming into you, and then your dad being super supportive. You have a mother and you have a younger sister.
Yeah.
Right? At that time, I think both of you were still single. Any other support from any other family members?
No. No.
Absolutely not. It
Absolutely
was
not.
just your dad.
It was just
or it
my
was a
dad.
hell-bent no.
It was a hell-bent no by everyone because not every family is happy for you to be a part of the movie industry. Not for any other reasons, but I feel because they have only seen most of the bad side of it. And it has
in other
created
words, bad side is written about more often than the nice side.
Because I feel like our families, especially from India and where we come from, they're a little more conservative. They cannot see their daughters on screen going and acting, or there are few things that are like a taboo. Now we are breaking out of it, but even then, for the rest of my family, they were like, "What is the need? What is the need for her to do a movie or to be dancing on screen?" It seems to be the way it's perceived is in a very different way. But over the years, they've understood that, it's also about the choices that I make as an individual, about what I want to be a part of. And a movie industry is actually one of the most influential industries. Like most of the youth are influenced by what they see on TV. So if you are a part of this industry, you should feel obligated and responsible to influence your audience in the right way. So that way also, I think they understood that I'm using this platform in a good way and not in a bad way.
See, there is an emotional part of you who wants to go back to movies from being in movies.
Yeah.
There's an emotional demand by the children from you. How do you balance both?
I have to.
How do you do that?
I mean, how do I do that? I have a very supportive husband. And that in itself, reduces all the stress to half. And if I didn't have his support, I don't think I would have been able to even sit here at this interview peaceful in my mind that, they're okay at home. You can have all the nannies in the world looking after your kids, but if you and your husband are hands-on, that is a different ball game altogether. So that is one thing that has really, really helped me.
See, you worked in Telugu movies, Tamil and Kannada. Obviously, each one has a different, apart from the language, there's a cultural difference. there
Yeah.
must be a working difference. Are they so different as we read about or see them on YouTube? What are the similarities? And
They are actually very similar. See, you can take the three industries like three sons, okay? A dad has three sons. They are one family, but only when you go closer and look, they are a little different in few ways. I every time that I was a part of either one of the industries, doing a movie away, whether it was Tamil or Malayalam or even Kannada, I was always accepted and looked after so well. I think if I have to say that if there was a striking difference between the three industries is the food. And I have to be biased and say that the food here is the best.
our food in
Our
our
food, yeah, the food
when you
here
say our, we mean
is-
Telugu food in Telangana and
yeah,
Andhra,
this is the
right?
best. I have to be biased.
Oh, what's
I
your
can't.
favorite food like? What
I
generally do you
love
like?
my Indian food.
And what's the food that you get on set? Is there a choice or there's a menu
No,
or it's a
it's
fixed
Indian
thing?
food. You will get white
And it's the
rice.
same thing for the director
See, it's like
to the
a
producer.
thali. It's like a thali. It's like a South Indian thali.
And you might like something, not like it, but you have enough that you like on
There's
a
a
thali.
lot. I always like food on set.
Yeah, that I know,
Yeah.
but we're trying everybody else to know.
Yeah. So yeah, there are so many varieties and options you can choose from. So you can eat whatever you want.
So that's a nice thing, right? For us in the hospitals,
Yeah.
a lot of people think we eat hospital canteen food. No, I come home every day
Yeah.
at 1, I
Yeah.
eat lunch 15
Yeah.
minutes and then
But
I'm
that is
off.
for you is every day, no?
Yeah,
So
every
every day you can't eat outside. Even I wouldn't want to eat like production food every single day. But while you're on set now and then
Then
and
it's
eating
okay.
the production food is great. Otherwise, no, of course.
Okay. So see, now that we know you are from a finance MBA major to an actor, motherhood, then you're wanting to go back into movies.
Yes.
And I already told you that she wants to. What is the advice that you would give to new mothers in different careers, not just movies,
Yeah.
but young mothers who are in a demanding career? I'm sure Dell was not simple. Dell is
It wasn't
demanding.
no, it was not simple. I mean, honestly speaking, if I had to give any advice, no matter what you are doing or which field you have chosen for yourself, I feel that prioritizing physical and mental health is very important.
So that comes to my next question in this.
Yeah.
And how are you keeping yourself mentally at peace at work, at home, with the children, their school? I know Guna, your husband, is a very lovely child,
Yes.
lovely guy. I
Yes.
don't think he's childish. I don't think he's a bossy guy. So there you have a big bonus
I
at
don't
home.
know anything about it.
So that part I know.
No, yes, of course, it is a great advantage with him. For me, if you're asking what has actually helped me, see, I mean, do you want me to say the truth?
We want you to tell us the
See,
truth.
for me, I'll tell you, Che, honestly and truthfully from my heart, it's my faith. Okay, my faith that has really helped me in the sense that my faith in my Lord and Savior Jesus Christ. Because it is not something scientific, but actually going in depth into this journey, it has healed my brokenness from within. And not just that, it's got me a lot of hope. And when I wake up in the morning, Jay, I wake up with so much peace. And though it may sound very spiritual, but it's something that is working for me. Okay, and I can't lie to you saying I do this, I do that. I hardly do anything much. I wake up in the morning with so much peace, and I guess it's a great flex to go into a day with confidence, knowing that God's got your back. And I feel like I've become very, very spiritual and very, very rooted in this from the time that I've got married, and it has changed my life in ways that I never thought were possible. So anything else that I do, no, whenever I'm going through some really, really stressful time, I sit down in a quiet room, I write my thoughts down, I pray, I seek for divine intervention, and I get it. I actually get the help that I need, so it's working for me.
See, morning routines when we were in college would have been very different for you as opposed to me.
Yeah.
Then you went into movies.
Yeah.
Movies has its own demand, sometimes early morning because the shot has to be done before sunrise or
Yeah.
late evening.
Yeah.
Then your marriage and motherhood.
Yeah.
Right. So how is your morning routine like today? Is it coffee, tea,
So,
or chasing the
I
little one?
don't drink coffee or tea in the morning. For me, my pick me up is music. As soon as I wake up, I have to switch on some music, and it could be anything. But usually, I listen to worship. But it's something that sets my mood and the tone for the day. After that, if you're asking me about what I have in the morning as a drink, I drink my collagen and my glutathione. I have this brand that I'm going back to every month right now, and it's working great for me. I take all my vitamins and everything and have a quick breakfast and head to the gym.
And what's breakfast like every day?
Breakfast for me, so whenever I'm going to the gym, I like to have eggs and bread in the morning. So eggs is my main portion. But if I'm not going to the gym in the morning, then I love to have dosa. I love to have dosa or idli with some nice gongura pachadi or something like
It's
that.
the pachadi that brings the taste out in the dosa.
And it's not so much that I want to eat the dosa for anything else, but I want to eat the dosa for the pachadi that I have.
Because dosa per se has no taste.
Yeah.
It's the chutney, the masala, the sambar that brings the taste out.
And I'm married into a Telugu family. So my mom-in-law and my father-in-law spoil me with pachadis. So I have all the varieties that I need. So I have so many to choose from. So
And all that dosa and chutney and you being so fit. What are the diet mantras or what is the diet control you do? Because
See,
you said you eat eggs.
I eat everything.
You like dosa and chutney, and then you're in a Telugu family, right? There must be some control. Otherwise, you wouldn't be looking the way you are.
No, see, I'll tell you, I don't follow a diet. I eat everything but in portion control. So
You please your eyes.
I please my eyes. My grandmother used to tell me that you have big eyes and small stomach. So I if I look at my food itself, it fills me to a certain extent.
You're halfway
and then
there.
I eat a little bit. But I don't eat like lots of rice with a little bit of veg. I eat more veggies and less of rice or roti, and that's how I balance it out. But it's working great. I can't do diets, okay? I cannot. Even if you tell me that it's the best thing in the world, I cannot do salad and grilled chicken. I have to have my Indian food. And I have to put like ghee and everything and eat with my fingers. So Jay, I have some questions for you as well. So what advice would you give new mothers as to the tests that they need to take post pregnancy or post delivery to make sure that they are healthy?
See, generally the tests required for an adult as opposed to a woman who's given birth, the tests won't change. What has to be added on is certain deficiencies, like in pregnancy, through delivery, cesarean, there might be a blood loss. So checking your hemoglobin, that is a subtle difference because there might be bleeding.
Yeah.
There might be changes in your sugar level because now you're eating for two. When you're pregnant, you're eating for two people, right?
Yeah.
So your consumption goes up
Yeah.
and you're at rest, right? You're not physically active, not working, not going to the gym, not running.
Yeah.
So you're eating more, or rather you're being fed more.
Yeah.
So there's more energy in your body, which is sugar.
Yeah.
So the chance of gestational diabetes, means diabetes in pregnancy, diabetes in gestation, is high.
Yeah.
That is a risk factor after delivery for that particular woman who had gestational diabetes to develop diabetes. So checking that becomes essential. Essentially, it is the drop in hemoglobin or the elevation of sugars that can pursue in a woman's life after childbirth. Otherwise, the test anybody should carry on every year, like a master health checkup, should comprise your blood routine, your urine, your liver, kidney, your sugars, your cholesterol, ECG, and X-ray chest, not while you're pregnant though. X-ray is radiation, CT scan is radiation, so never during pregnancy.
Okay.
then your ultrasound abdomen. These are your basic tests.
Okay. I've also heard like a test like pap smear. Am I right?
Yes, pap smear, if in general, pap smear should be done in any adult woman,
Okay.
because it identifies the risk of cervical issues, cervical neoplasias, malignancy.
Yeah.
So we also look for ultrasounds in women specifically, because there can be like fibroids in the uterus, ovarian cysts. We see PCOS all the time.
Yeah, that's what.
So because these will eventually cause hormonal problems, menstrual irregularities, which all eventually leads to stress, inflammation, and other health issues.
Yeah, that's right.
And pap smear helps us identify cervical changes early, so that we can earlier we identify you at a risk of cancer, the better prepared you can be to prevent it.
Yeah.
So that is the idea. And
so whenever you go like for a regular checkup to your gynec, you can always have these tests done right there.
Correct. Yeah, these can all be done at home also. Like all your blood tests can be done at home. Your blood, your urine, your liver, kidney,
yeah,
sugar,
of course,
cholesterol.
those. I'm talking about the
Pap smear requires a gynecologist to do.
Yeah.
Ultrasound, X-ray, ECG, you need to be in a lab or a hospital.
Yeah.
And mammogram should be done up for a woman above the age of 40.
40.
40. Because what we look at is breast cysts, breast adenomas. So there's categories. Birards 1, 2, 3, 4. 1 and 2 are very mild.
Yeah.
But the 2B, 3 or 4 require a biopsy.
So you suggest that once in a year at least?
Once in a year, you need your basic checkups.
Basic checkup. Okay.
Yes, an ultrasound, blood, all your blood, urine, liver, sugar, cholesterol, ECGs once a year. Echo and all your heart function will not change drastically, right? Your ultrasound will not pick up a tumor every year. So those things you can do every couple years, unless, for example, your blood test identifies that you have sugar. You should be smart enough to keep checking it every month. Now that you have sugar, apart from checking your blood sugar every month, you can check your 3-month sugar, like the name, every 3 monthly. Check your kidney also 3 months. Every 6 months, your cholesterol changes. Now, a lot of people say thyroid, I'll check after 3 months. See, what is hypothyroid? Thyroid function is below level. Hypothyroid. So your body is not making thyroid. So you are being given a thyroid tablet. What you are taking is a thyroid hormone,
but can you,
which changes in your body every 8 weeks. 2 months.
So thyroid can be, you can recover from it naturally also, or only through pills?
99% of the time recovery is only with medication, and we won't call it a recovery. We are giving you a medication to bring your hypo level, which is low, to normal. And that should be checked every 8 weeks, as in 2 monthly. So the dose adjustment should be done in hypothyroid, low thyroid, by giving thyroxine. We check TSH every 2 months.
2 months. Okay, so another question that I had, usually with my kids, when I say no for a chocolate, I become the villain there. And I'm sure you also face the same, but I don't want to be like an obsessive parent where I'm like, no sugar at all. I let them have sugar, but I keep it in control. But what I wanted to ask you was, what is the deal between salt and sugar, and how can they actually affect our health?
According to me, Anisha, the two biggest culprits in life are your two white powders, your sugar and your salt. Sugar, more essentially, more dangerous. When you eat a lot of sugar, your blood sugar level rises. So your body will automatically produce insulin to push that sugar into a cell, so that from the blood it goes into the cell, blood level comes to normal. So every time you keep putting more sugar, sugar rises, insulin comes, pushes it till that cell becomes full and says no more insulin, thank you. So insulin becomes resistant. So now that insulin is resistant, it is not functioning properly. So your sugar level keeps going up. When that goes up beyond the level and does not come down, it is called diabetes.
But
diabetes affects not diabetes. See, diabetes in control is not dangerous at all. Uncontrolled diabetes will kill you because it can cause vision loss, retinopathy. It can cause strokes in the brain. It can cause obstruction, blood flow obstruction in your legs, in your peripheries, generally the legs, peripheral vascular disease. you can go into kidney failure, you can get heart attacks. And trust me, there are so many things diabetes does.
So diabetes, usually when we think of diabetes, we think of adults, but it can happen to kids as well?
Oh yes, diabetes, what you generally hear is type 1, type 2. But there's diabetes, maturity onset diabetes in the young, which itself is of 17 types.
Wow.
So type 1, generally we see less than 30 years.
Okay.
Type 2, you see generally in people who are above 30.
Okay.
So type 1 is also very common in children, where type 1 is insulin dependent, means there is no insulin.
Yeah.
Only way to treat type 1 is by giving it what it is deficient in, by treating it with insulin. No tablet will work in type 1.
Okay.
Type 2 is because of what I explained. You keep eating sugar, you keep eating, sugar level, insulin becomes resistant. So insulin is resistant. So you can treat it with tablets also.
Yeah.
Eventually insulin.
Okay. So I want to ask you, so how good is it to have like a sugar-free, supplement, or like, instead of sugar, people usually have sugar-free, or now you have these new sugar-free options which are made out of fruit. Are those better or
anything sucrose, glucose, fructose, whatever ends with that O's is sugar. Whether it is sugar-free sugar, whatever is all sugar. And don't listen to people saying eat jaggery. Jaggery will cause the same damage as your sugar.
So
your honey is as dangerous as sugar. I see a lot of patients, sir, I've stopped putting sugar in my coffee, I'm adding honey, but my sugar is not improved. It is sugar. It is not going to improve. Jaggery is not going to improve. Fresh fruit is good. It can cause an elevation in sugar. Fruit juice is absolutely bad.
Oh, is it?
Fresh fruit or fresh fruit juice is good. Your Tropicana, your real, they're all absolute rubbish. In other words, anything that comes packaged is refined, ultra processed.
So
ultra processed sugar.
What would you suggest that somebody takes?
What your mother cooks, or what you cook at home.
Instead of sugar, like supposing for those who are having like a cup of coffee in the morning and they're used to like either sugar free, but you're saying both are equally bad. What would they?
So I'll put it this way, Anisha. If your sugars are in control, you can enjoy life. But let's be smart about it. Because right now you're in control.
That's right.
It might not be the case 5 years
down the line. 5 years from now.
So your life today is not defined by what you're eating today. Is being defined by what you ate 5 to 10 years ago or for the last 10 years. So you see a lot of youngsters drinking like a fish today. There are some friends of ours which we all know. They take joy in saying, I drank till 1 in the morning, 3 in the...
But
they're
the effects
fine today.
Will show
the
much
effects
later.
Of this will show because of the chronicity of what they're doing with themselves in 5 to 10 years. That is why you see a lot of people saying, I was fine till yesterday. Today, my uncle was fine till yesterday. He played, went walking in KBR, did 2 rounds. Today, he developed a heart attack. How he was normal yesterday? He was never normal yesterday. You never checked enough. See, what kills you? The heart kills you. The heart has 3 systems. It has the current of the heart, which is identified on your ECG. You have a muscle. The pumping of the heart is identified on an echo. The pumping will not be seen on the ECG. The electric rhythm will not be seen on the echo. Now, what kills you? A heart attack. Means what? Blood is not flowing. ECG or echo will not tell you unless it is 100% blocked and you are having a heart attack. What tells you is your angiogram. Angiogram now takes only 5 minutes. You can go to any lab. I suggest a hospital. Any hospital, go for a CT, coronary angiogram. In 5 minutes, you'll know your status. So you were never fine yesterday and got a heart attack today. It has been building up. You only checked ECG and echo. They never told you about your blood flow. Now your blood flow is blocked. You had a heart attack. Then apart from sugar, salt. What is salt? Sodium. Sodium is essential for life. When it is, you take it in disciplined quality. Not, I want more salt. We see a lot of people, and there's this salt bag I used to put in. That is absolute rubbish in
Is
my
there any
opinion.
difference between like pink salt and white salt?
The salt is salt,
Salt is salt.
is sodium. There is nothing like good salt or bad salt, just like there is no good sugar or bad sugar. Anything in moderation is good.
Yeah.
Eat or drink with 10 years in mind. High sodium, which is high salt, elevation of blood pressure, the same organ damage wherever blood flows to. If your blood is flowing fast at high pressure to your eye, blindness, retinopathy, bleeding in the brain, stroke, renal failure, heart attack. So the end result is eventually death. But death might not occur suddenly, spontaneously, calmly for you in your bed. You might suffer. See, nobody wants to do that, right? You ask any person, do you really want to go through this? The answer is no, I don't want to. But then the answer is, do you want to control it? No.
That's right.
Sir, you're giving me medicine. No. See, medicine is not our first choice or priority. Your lifestyle is your first choice. You have to watch what you're eating. Eat lesser. Get in shape. Second is exercise. So watch what you're eating. Exercise to finish the energy that you have eaten. Third is medicine. If third medicine, and if you think, oh, I'm not going to eat right, I'm not going to exercise because doctor has given me medicine, the fourth thing will start, side effects of these medicines. And by this time, your BP would have shot up through the roof. You would have become resistant to the medication. Sugars are gone up. You have developed insulin resistance. And the only thing that you can go through is more of three, which is more of medication and eventually side effects, and God help you. See, so diabetes will not kill you, Ray. Uncontrolled diabetes will kill you.
So now that we're talking about eating, how do you know when you're obese? Like, is it because of the weight, or is there any other indicator that will show you?
See, obese is a medical, mathematical definition. It is your weight in kilograms divided by height square, when height is in meters.
Okay.
For example, I am 58 kgs. My height is 5'6", which is 168 centimeter. So that is 58 kg divided by 1.68 in meters, no? 1.68 into 1.68. That will give you, I think, 20 to 21. That's about it, right? You can show the calculation, no? So if you are between 9, that is your body mass index. You will probably be around the same. If you are between 19 to 25, you are normal. Below 19, you are low weight, low BMI. Above 25, you are high. If you're between 20 to 25, you're obese.
Okay.
Sorry, cut that. So 19 to 25 is normal. From 25 to 30 is overweight. 30 to 35 is morbid obesity stage 1.
Okay.
35 and above is morbid obesity type 2. Why morbid? Why being obese? Because it brings a lot of morbidity. Means lot of morbid health issues. Means knee pain, your body is not able to take it. Your blood pressure goes up because the blood has to pump hard to reach all the tissues. You have so much inflammation in your body, your sugars are high, cortisol is high, diabetes. So do you think somebody who weighs 150 kgs and who's only about 5'6" will be able to walk or run? He can't. So his chronic problems, chronic morbidity increases. So morbid obesity type 1 and type 2. So knee replacement is planned earlier for somebody who's very fat, very big with obesity, because their knees are now taking a toss. The load on the heart is very high. So there are multiple studies who say somebody who drinks and smokes and exercises every day, their health and their lifespan will be far more than somebody of the same age who drinks and smokes but does not exercise. So it's not drinking and smoking is bad in this equation. It is bad. But somebody who drinks and smokes and exercises, because he exercises, it is far better than somebody who does not exercise. That is a very big study that has been done all over the world. So all they want you to do, if you can't change any of your lifestyle, exercise. And exercise obviously reduces inflammation, reduces your blood pressure, reduces your sugar. And if you're exercising, trust me, you go to the gym every day. I walk in KBR every day. we watch our diet. Because why are we exercising? Because we want to be fit.
Yeah.
Why do we want to be fit? So that we can have the same quality of life that we are having today, 10 years, 20 years from today. And trust me, you and me will continue to exercise this way.
That's right.
And our efforts at exercising or gym or walking will never go down.
It'll never go
It
down.
will only increase.
Yeah.
Because I started with 1 round of KBR. Now I do 2.
Yeah.
Now I was telling my colleague who I walk with, let's start doing 3. And he looked at me the other day saying, are you mad?
Yeah.
Maybe I don't want to do the 3rd.
Yeah.
But there is a thought in me that wants to do go another round, because it makes me feel better. There's endorphin release, there's a feel good factor.
That's right. It's a feeling.
And then it wants me to,
when you work
then
out.
it makes me want to watch my diet. Now,
see, talking about weight gain and diet, for some people it's not the diet that is making them put on weight. There could be other reasons like a thyroid issue or something like that. Is there a correlation of other things as well apart from the usual diet?
See, it's generally environmental and physical factors. There are genetic issues which can allow your body, though you eat less, to put on a lot of weight. But that is less than 1% of the population of people who are obese. But yes, there is an end. That is your genetic within your body. There are environmental factors like you eating whatever you see, not having a control or anything. Chocolates for the last 20 years, packaged chips for the last 20 years, popcorn everywhere, caramel popcorn, 1,000 rupees in a movie theater, sitting and doing.
I love caramel popcorn.
Yeah, but look at you. You can afford to eat it. I can afford to eat it.
Just because my weight is less, so I can afford to eat it.
Yeah, as long as your sugars are in control, your blood pressure is in control, and trust me, you're not eating it every day.
It's not about the weight, but it's about your control of your sugars mainly, right?
And when do you eat caramel popcorn, Anisha? Maybe once in a month if you go to a movie.
Yeah, not every day, for sure.
Those are perks that you can enjoy.
Yeah.
Right? We don't want you to not do that also. Then what's the point of life, right?
Exactly.
So this environmental sitting and doing nothing, people on a desk job. Drinking every day. So somebody was telling me, do you drink regularly is the question they asked their patient. He said, no sir, I drink occasionally, but occasion comes regularly. So those are the people who have these serious issues 5 years down the line. They won't have it today. They'll have it 5 years down the line.
I understand.
So,
I see it.
So then chronic problems like diabetes, then genetic diabetes from parents, they get it. Hypothyroid. Thyroid is not being produced well. So thyroxine levels are low. Then they develop hypothyroidism.
How common is it after pregnancy to get a thyroid issue or something like that?
Thyroid issues can occur to any person. Anybody. There are hormonal fluctuations that occur more in women than in men. And because of women and the genetic composition, there is a risk for women to develop hypothyroidism more often. Hyper is when your thyroid is working more. That is rarer. But we do see it regularly, but not as much as hypo. Thyroid is the most important hormone in a human's body, men or women, because that hormone controls your metabolic rate, your metabolism. Metabolism controls your different functions. Your different functions are essential for you to live.
That's right.
So when thyroid, the most essential hormone, is not being produced, what we call hypothyroidism, your body takes a toss. You start gaining weight. You eat less, but you gain weight. You feel cold all the time. Your heart rate is low, BP is low. You're not able to use the bathroom frequently, or rather you're constipated, period abnormalities, hair loss, no sweating, dry skin. These are hypo. The opposite is hyper. So how we treat hypo is with thyroxine. How we treat hyper is by blocking thyroid function. So they're completely different. And diabetes is something you can also develop more frequently in women.
Usually they say diabetes means you're eating too much sweet, but is that actually true?
So diabetes also has a genetic element, which is type 1. Type 2 occurs generally because of your diet or the excess diet. through your sweet, eating
Okay.
all the time, snacking, processed food, your colas, your chips. And
So it could be all
a
of these
combination.
together. It's
Yeah,
not
it could
just
be even
eating
one.
sweet.
It could only be one, but
Yeah.
it is generally a
Generally,
combination because
yeah.
look at today's life. Yeah.
That's right.
You look at today, you open Instagram, there's somebody popping some bubbly champagne, somebody eating a big caviar meal, somebody drinking Coca-Cola, and Warren Buffett saying, I drink Coke and McDonald's and nothing happened to me. But he's lucky that nothing happened to him.
That's
we
right.
wish him well.
Yeah.
But that's not the case for everybody.
Yeah. So what are the three, what are the top 3 lifestyle changes that everyone should make for a better health?
Wake up early
Yeah.
and sleep early.
Okay.
Work out every day or at least a walk. Once you're the age of 35 and above, you start losing 4%, 5% of your body mass every decade.
Okay.
So physical training through resistance training or weight training is essential. Sleep is very important. Sleep consolidates your memory and reduces stress. Don't think too much about things that are not in your control. My manager is going to remove me from a job, means that is the manager's decision. There is not much you can do. So don't stress on things that you can't control. Wake up early, sleep early, eat regularly, watch what you're eating, sleep well, don't stress unnecessarily. I think that would be my basic things. I can always tell you, don't drink, don't smoke. See, you have to choose what works for you, what doesn't work for you. If you are in a job where you require to take people out to entertain, to socializing is a part of your life.
Of course, you can't not do that. You can't not have that
if
side.
I tell somebody don't do that,
then
that fellow will not have a living. Smoking is bad for you.
Right.
Today they even say one drink is also bad for you. There's no one glass is good, 2 glasses is good. That doesn't exist. But in our life, you can avoid Coca-Cola, you can avoid your Sprite, avoid your packaged processed food, avoid juices which come in a canned container. As much as possible, eat at home. Don't order your Swiggy.
When you're talking about Coke and sometimes they say Coke Zero, is that equally bad as the regular Coca-Cola that we drink?
So Coca-Cola is processed empty calories. You're just putting calories in your body with sugar. It is empty because it has no nutrients. But it has calories. But Coke Zero is again empty only, and it has no sugar or zero sugar. To make it zero sugar, it is a highly acidic substance with a pH of I think something like 2 to 3.
Wow.
Your stomach is acidic, so it's okay. But it's not something that you should drink regularly.
On a regular basis.
Just because we told you don't drink Coca-Cola doesn't mean you'll drink Coke Zero. That is just as bad.
So people say that high BP isn't always visible, but what do you think are the actual red flags for this?
See, blood pressure is not by looking at someone. Blood pressure is identified when we connect a blood pressure machine and check your blood pressure. Normal blood pressure, assuming you and me are normal, is less than 120 by 80.
Okay.
Above 140 by 90, you need to be treated. So between 120 by 80 to 140 by 90 is pre-hypertension. You're not normal. You are not hypertensive, but your chance to go that way is high. So here is where we want you to undergo lifestyle control. Eat less salt, less sugar, work out regularly, be more physically active, watch what you're eating. So you go towards the normal side. Well, if that's not happening, you cross 140 by 90. It's not a combination of 140 by 90. It can be above 140 is hypertension. Even above 90 is hypertension. So that is stage 1 hyper when you're 140 by 90 to 160 by 100. Above that is stage 2. Generally, what do they come with? My chest is heavy. Sometimes I feel breathless. My swelling is there in the legs. I start getting angry, anxiety. So these are the general red flags to watch out for. Another red flag, what I think is if the parents are hypertensive, the chance that you have it is very high. And there's nothing like getting yourself checked. A master health checkup. Why do you want to wait till see,
till something happens.
all of us have a car. We service
And
our
even
car
that,
once every 6 months.
I use your service, your health at
The home
home.
care.
Yeah, that's the most
And
convenient
I don't,
thing.
yeah, so they come home, they do
Yeah,
your
they do
samples, they do your
everything.
ECG,
Yeah.
they do your x-rays also there.
Yeah,
You
yeah.
do all your blood, urine,
Yeah.
liver, kidney, sugar, cholesterol, BP, ECG,
Actually,
and what more here? All you have to do
don't
is
have
call.
an excuse now.
All they have to do
get
is just
everything
call
checked
this
out.
number, and
Yeah.
that fellow will come home, do
Yeah.
your samples,
Yeah.
report come on a PDF, including your ECG, and you can always call me or go to your doctor.
That's right. So, Chair, you look very fit. Your skin looks pretty clear and glowing. So, you need to tell me something about your diet.
So basically, I wake up by 4:45 every day.
Wow.
And you're
Good
saying,
for
wow, but you
you.
knew
Good
that
for
all
you.
through.
Good for you.
So I wake up early. I sleep 8:30 every day. It's early sleep, early to bed and early to
Early
rise.
to
I'm
rise.
in KBR by 5:30.
Nice.
I prefer not to have a cup of coffee till I finish my walk.
Yeah.
But then I somehow I'm not able to do that. It is always good not to have your coffee for at least an hour from the time you wake up.
Yeah.
Because your natural cortisol goes up.
Yeah.
Let it come down. Then you have your coffee. But unfortunately for me, I'm not able to do that. I can always say I don't have your coffee, but that's not the way. This is one thing that I am trying to change in myself also. I do one round of KBR, sometimes two. In fact, it was always two, and now it's become
You
one.
don't want to ever get into like weight training or
I
something
used
like
to
that?
do some amount of weight training, Anisha, you know that. And then that kind of disappeared, which I'm kind of missing.
Yeah.
Then I come back home, shower, drop my little fellow in HPS, come back, and my breakfast is 5 egg whites, a portion of boiled vegetables, and some fruit.
Yeah.
And I have another cup of coffee. Then is the hospital. I come back home for lunch at 1.
Yeah.
1:30 I'm back, and I come back by
So
4.
even when you come back for lunch, you're eating light.
Yes, I am generally not a heavy eater. Kind of look at me, I'm not a heavy eater. I'm like you. I see what I'm going to eat, and I serve one plate, and I never have a second serving.
Yeah.
If I'm actually having a second serving, everybody in the house is actually surprised that this fellow is eating a little bit more. Is it
so
going
what
to snort
kind of
today?
food is that will make you want to eat like a little more?
I like barbecue ribs.
Okay,
I
nice.
like pork barbecue ribs.
Nice.
That's one thing that I really like. I like chorizo pizza. Pepperoni not much, but chorizo. I think these two are what I really enjoy.
Oh, that's nice.
If you ask me sweets, I like jalebi as a sweet, but not the regular jalebi.
The regular jalebi,
regular
of course. Yeah,
jalebi
that's
is
the
what
that's the actual one,
what I
not
like.
the other. There's another type that is
Bellam jalebi.
That's not jalebi.
A lot of people say bellam jalebi. No, the regular jalebi works for me.
regular is good.
And I like bubblegum ice cream.
Bubblegum ice cream.
You get that
interesting.
in Cream Store.
Okay.
So there's bubblegum.
Yeah.
Even my son hates it. I always thought kids would love it. And I like that Ferrero Rocher ice cream occasionally.
Yeah.
And I have no health issues. I had a big health scare. You came saw me in the hospital.
Of course
That was kind of life changing
scared all
for
of
me.
us.
And
But you have recovered so well and recovered so fast, and I'm sure that you have a lot of credit to give to your lifestyle.
Oh, absolutely.
Right?
See, my lifestyle was, I wouldn't say, my lifestyle wasn't the way it is today. But I also won't put it in a bad lifestyle boat. But so I was walking before that also. I used to work out before that also. But it is some ice somewhere in some drink that gave me typhoid. I underwent multi-organ issues. Had to undergo a major surgery and all that. But anyway, that was a 15-day ordeal, another 15 days post thing. I know you came to the hospital and all that.
But I'm sure
And
you
it's
must have
been a
had
year
so
now.
many depressing thoughts at that moment. So how did you deal with that?
Oh, I think I was heavily sedated. I had no
Okay, so
idea.
you went through it very peacefully.
I went through it peacefully, came out. But when you wake up, you're in a lot of pain. See, there's a tube in your nose, your throat,
Yeah, I
in
saw
your
you
neck,
with it. So yeah,
2-3 tubes all across your abdomen. I know every time you walk, there's something or the other bothering you. And that was that.
That was that
But anyway,
phase,
your
but you're doing a
diet,
good
your
phase.
lifestyle will control your health today
Yes.
and mainly your health in the near future and hopefully forever.
Yeah.
But we all can't live forever.
That's right.
We are a finite being in this infinite universe, right?
Yeah.
So whenever you live, be good to people, you be good to yourself. Your
That's
body
very
is the
true.
only place you live. Yeah, you got to
Yeah.
take care of that.
Yeah.
So now, Anisha,
Should I put
it's
this?
time for our rapid fire round. Not like
Let's
the
go.
round of shots you had in that movie Nagarani Kemaindi, but
Okay,
we are
not
going
like
to
that.
fire something
Yeah,
away, but with
yeah.
truth bombs.
Yeah,
So
done.
there we go.
Done.
Coffee or green tea?
I don't drink coffee or tea. As I said, my morning pick-me-up is music.
So I know you also don't drink whiskey or vodka, so that answers it.
Yeah.
Gym workout or a home workout?
Gym, always.
Biryani or pizza?
Biryani for life.
Hands down? That's
Hands
chicken
down.
or lamb? When we say mutton, it is when we say biryani, it is mutton.
Mutton
obviously.
biryani, yeah.
Dream co-star for your comeback movie?
I'm still dreaming.
Still dreaming. One skincare product you can't live without.
Lip balm.
Who gives the best health advice in your family?
You give me the best
Thank
advice.
you. So the weirdest food combo that you like.
So I don't know
Or
whether
you
this
enjoy.
is the weirdest food combo or not, but Guna tells me that you cannot eat pulihara with chicken curry. Is that true?
Actually, never tried that, but I think I like pulihara with curd. Yeah.
No, so I love to eat pulihara with chicken curry, and I think that is the best combination that could ever have. But my husband thinks that I am absolutely a nutcase for doing that. Let's start with your rapid fire now. Okay, so your first question. One guilty junk food that you really like.
KFC Zinger Burger.
Really?
Yeah,
My kids...
it costs 149 rupees, but I thoroughly
And
enjoy
also,
it.
you know, the KFC chicken popcorn,
Yeah.
you can eat it anywhere else, but KFC popcorn is KFC,
It's KFC
popcorn,
popcorn.
only. Okay.
That happens a lot in my house too.
Okay, if you weren't a doctor, then what would you be doing?
Lot of people say I would have been a mechanic because I can fix small little things in cars and bikes. So
yeah.
even I think so. I would have been a mechanic.
Salt or sugar, which one would you prefer or resist?
Of the two, I'd prefer none.
Yeah,
I would
okay.
resist both. But if I didn't have a choice and I had to choose one to survive, I would pick sugar.
Sugar, good choice. So what is
But
your...
it's bad for you.
Of course, but you always love your little dessert at the end. Okay, so what's your stress buster after a long day at work?
Generally, I come home at 4:30, then have a cup of coffee, go back to the office, come back by 6:30.
Yeah.
I sleep by 8. By the time I'm at home, the little fellow, my son, is there. And that fellow and his Lego and you know,
Yeah,
the
just
stress,
spending time with the kids is such a great
such a
stress
nice thing.
buster.
And then once in a couple months, I just take off on my bike, ride to long distance.
I
to
remember
go
you
out
used to
with
do these races, no?
Yeah.
Are you still doing them? Are you still
No,
racing?
this was last year was the last time I did extreme
Okay.
racing,
But do you
because
wanna
extreme
get
racing
back?
I looked at it as a stress buster, but then realized all this racing adds to your stress.
Oh,
yeah.
really?
And then because it's a 10-day race,
Yeah.
and then there's preparation of 2 months
Yeah.
before, and you come back from that 10 days and you
Yeah.
need another 20 days to recoup.
Yeah.
So I gave up on it.
Okay, so you're never going to go back to racing?
I don't know, Anisha. See, because till last year, we were competing to win.
Yeah.
I think that's where the stress is.
Yeah.
But now I've come to the position where I've won enough. I've competed in enough.
Yeah.
A lot of people know my name, know who I am, and I've proved what I wanted to. Today I don't have to prove it anymore.
That's right.
Maybe
That's a great place to be.
So I'd love to go
That's
back
a great
there.
place to
I'd
be.
love to go back into the racing scene.
Yeah.
And not race against anybody. Forget the timing, the quickness.
Just
Leave
enjoy
it.
the
Just
moment.
finish the whole thing
Yeah.
and enjoy it and come
Yeah.
back. That's what I would probably love to do.
Love to do. Okay, give me a fitness myth.
Walk every day. See, your physical exercise of if you want to lose weight.
Yeah. Yeah.
So what you do could be the same thing, but what time of the day you do is important. If you want to lose weight, running or walking in the morning, because your body has not eaten much through the night.
Yeah.
So the excess reserve is utilized in your walking, running to burn fat.
Yeah. Yeah.
But you wake up in the morning, you eat breakfast, a lunch, some snack, you go to the gym, you are trying to expedite what you ate through the day.
Yeah.
So you're actually working on what you ate
Yeah. Yeah.
rather than depleting what is stored.
Yeah.
So if you want to lose weight, walk or run in the morning.
So is there a difference between running or walking on the treadmill and actually going for a walk or a jog?
Yeah, so there are multiple studies which are
Okay.
done. Old generation treadmills, knee pain, hip pain.
Yeah.
Today's treadmills, fantastic.
Okay.
So the efficacy of a treadmill is just as good, probably better than nature. But nature has its own charm. You're walking in a park. There's a nice weather. There's probably a pretty girl walking next to you too, right? So all that happens, but that cannot happen on a treadmill. But treadmill per se.
There can be a pretty girl walking next to you, even
In a gym.
in the treadmill beside you.
Yeah,
But you're
that's
married.
True, but I'm married, and so there is a difference in the environment.
Yeah.
That's all.
Yeah.
It's nature. You're not having sweaty people in a park as opposed to sweaty people on a treadmill.
On a treadmill beside you. That's very
important.
Very relevant.
And the weather plays such a good thing
That's
early in the
true.
morning.
And also being around nature and everything
there's
just
fresh
uplifts
oxygen.
you. You
Like-
feel so great. I feel if you want to feel most connected, like spiritually, you have to be in nature. I
And
feel that way.
when I walk in KBR in the morning, yeah, so many business ideas, business thoughts just run across my head. I wonder if this happens to everybody. So I asked a few people. All
Yeah.
of them feel the same.
Oh, really?
And it's a feel-good factor. See, when you finish 4.5 kilometers, 4.150
Yeah.
kilometers in 34 minutes,
Yeah.
it's almost as fast as slow speed jogging.
Slow speed jogging, yeah.
Sometimes I overtake while I'm walking. I
Yeah.
overtake some slow joggers. So
Okay.
I walk very fast.
Very fast, yeah.
And then it's nature, yeah, breathing oxygen. You see some birds. There's peacocks and peahens everywhere in KBR.
Yeah, that's amazing.
And Sundays, one day I don't want to go to KBR.
Yeah.
Because if
it'll be too
normally if
packed.
there's 300 people, there's
Yeah.
5,000 people on a
Yeah,
Sunday. So
yeah.
Sunday I avoid,
Yeah.
and Sunday is my rest day.
Yeah. You should always have one rest
And I
day.
enjoy
And
because-
on that day, you should just switch off completely from everything and just
Because Saturday
relax.
night I like to go out.
Yeah.
I'm not much of an eater.
Yeah,
A drink
I know that.
a drink
yeah.
or two with
Yeah.
friends. Enjoy
Yeah,
yourself. Come back
home
sleep.
and go
Sunday generally, Saturday is a little late. I sleep at 8:30. Sunday might be 12:01, but
Yeah.
it used to be much later. But I
So
don't
you
suggest
said
that.
you love a Zinger burger?
Zinger.
So apart from a Zinger burger, if I had to, ask you what would be your ideal cheat meal, what else would it be?
It'll be a chorizo pizza, some
Okay,
Park
pizza.
Avenue, any of these pork ribs.
Okay,
From,
so it's
that I
that's
like,
your
I
standard
like. That's my
cheat
standard.
meal. Okay, great.
Because biryani you get everywhere.
Yeah,
So I
yeah.
wouldn't say my cheat meal is biryani because you're getting that regularly.
Yeah.
That's- And then to
That's
top it up,
amazing.
some jalebi with vanilla ice cream.
Vanilla ice cream. That's good. Great. So I don't have a hamper to give you
Oh,
for
I thought I
doing
should
so
give you
well
one. I
in
thought I should give her
your
one.
what is this rapid fire round.
No, so we aren't done yet, Anisha. There's some more questions for you.
Okay.
Craziest DM you received from your fan?
It's not very crazy, but everybody seems to want to give me advice, like free me.
Free me.
Why did you choose to get married so soon? You have spoiled your career. People will just I understand they're well-meaning, but random.
It's not
full advice.
necessary.
Yeah, unnecessary advice. Yeah.
So which Tollywood celebrity has the best gym routine?
Physique right now, I think
No, just fitness routine.
fitness routine, I really feel right now the three big names, Tarak, Ramcharan and also Mahesh Babu, all three of them are super fit. And I'm sure they have incredible gym routines.
So after Visham, any film comeback on the horizon?
Yes, I'm doing Inagranike Maindi too.
Part 2?
Yeah.
Oh, I didn't know that. Thanks for telling me before. I get to know that with all of you now. So one rumor about you that's actually true for them to know. Because I know enough.
I am a very private person, Jay, and I have not been a part of any spicy gossip or rumors. I've always kept myself away from it. So there's nothing really.
Thank you, Anisha, for sharing your journey with us. To all our listeners, don't forget to like, share, and subscribe, and comment that one thing that you're stealing from Anisha's wellness routine. Bye-bye.